All right, we will call the Committee on Health and Human Services meeting to order. Madam Clerk, can you do roll call for us?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Right here.
Chair Baker McCormick.
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
There are no remarks today. Next item.
C, approval of the September 7th, 2021 meeting minutes.
I'll move their approval, Madam Chair. Colleen.
Is there support?
I'll support.
It's been moved and supported. All those in favor, say aye.
Aye.
Aye. Anyone opposed? Any abstentions? If none, motion's passed. Next item, please.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, requesting commission approval of a 2-year intergovernmental agreement with Health Choice of Michigan.
All right. Is there a motion?
Move for approval.
All right, and
Support.
it's been moved and supported. All right, let's discuss this matter. Are there any questions? It looks like Commissioner Killeen, Vice Chair, go right ahead.
Thank you, Madam Chair. This provides administrative support to the Health Choice Program, which is something the county initiated. I see this as 2 years and $1.4 million, almost $1.5 million. What were the previous levels of support for administrative and management support? Has the county done in the past? How does this 1.475 compare to what we have spent in the past on this?
Is there someone from the administration to speak on this item?
Yeah, hi, Chris Johnson. Can you hear me?
Yes.
Yes,
Okay,
we
Chris
can.
Johnson.
Hello, Chris.
Hi, how are you?
Good.
I'm the Division Director for Access to Care within the Department of Health, Human and Veteran Services, and I'm also the Executive Director for Health Choice of Michigan. So the last contract that came before the commission was also a 2-year contract, and that amount was a not to exceed of $1,494,364. So it's very, very close. What we do is it pretty much covers the budget for the Access to Care division within the department. And so it's a not to exceed amount. And so we reconcile it at the end of the year. And so the current contract gets split up at $737,917.
Thank you, Mr. Johnson. And just for full disclosure, I'm a board member of Health Choice. Thank you, Madam Chair.
Thank you, Commissioner Killeen. All right, it's been moved and supported. All those, let's do a roll call vote on this. Madam Clerk?
Commissioner Marecki.
Yes.
Commissioner Dobb.
Yes.
Commissioner Anderson.
Yes.
Commissioner Killeen.
Aye.
Chair Baker McCormick.
Yes. Anyone opposed? Any abstentions? All right, motion passed. Next item, Madam Clerk.
Item 2, requesting commission approval of a grant acceptance with the Michigan Department of Health and Human Services.
Is there a motion for approval?
I'll move to approve, Madam Chair, but I do have a question.
Question, okay.
Support Anderson.
Been moved and supported. Discussion? Mr. Colleen or
Thank you.
Commissioner Colleen?
Yeah, thank you, Madam Chair. Two things on this. The term of the grant is from February of this year, February 1 to September 30. So the grant is up in a couple of days here, a couple of weeks. Two things. Why are we just seeing this now? If the grant was supposed to start February 1st, have we done work under this grant prior to approval? So I guess it's three questions. One is, why is it late? Secondly, has there been any work done? Has any of this grant been expended before the commission has had a chance to approve it? And then I guess the third thing, what's the plan for October 1 of 2021 with regards to contact tracing and wraparound services? Thank you, Madam Chair. Those are my questions.
Hi, this is Carol Osterberry, Health Officer, Health, Human and Veteran Services. And yes, it goes back to February 1st. We were not notified of this until later in the year. Second question, as far as work being done, we have, this is also being used to pay for a staff person, for software, epidemiologist, and then we are purchasing software, statistical software, so that our epidemiologists will be able to have improved monitoring and surveillance of our contact tracing, our cases. And this will then lead into an advanced and upgraded COVID-19 dashboard on the website. This also is being used for the outreach campaign. And that came to the commission last week.
Right.
Those are the costs.
Okay. Have we then hired, if we just found out about this grant, have we hired or spent money out of this grant yet?
The department, Michigan Department of Health and Human Services, allowed us, yes, to begin expending the funds. And so, yes, we did bring on that epidemiologist.
Well, that's interesting. The state gave you the go-ahead to start spending the money before the commission accepted it. Yeah, I guess I would like to hear from Commission Counsel on that if she is around. Is that the proper way, Commission Counsel? Can that happen?
Through, I'm sorry, through the chair, that is definitely not the usual course. I would tell you that's not the course that should have had occurred. I'm not sure what occurred specifically in this instance. Maybe we can get some additional information offline from the department, because if commission approval is required, then there shouldn't be any expenditure of funds. And I don't know if they started services and then have the funds been expended, Carol, or did the services just occur and it's essentially almost like a retroactivity thing, even though we don't consider it retroactive because it's a grant?
Right, the state is not seeing it as retroactive. And as far as services, as I said, it's for really for purchase of items. And no, the services from the Brogan contract that was approved at the last HHS committee meeting and will be for full board, that will then, as I explained, then those ad campaign and the outreach and all that will be purchased all before September 30th, and then run, start in September and run through the fall, which is acceptable for the way the grant funds to be spent by the state of Michigan.
Okay, so we have additional contracts associated with this that the commission has authorized already.
That is correct.
Okay.
And Madam Chair, as council has said, this isn't the way we do stuff. I don't recall that we discussed when we approved the contract a few weeks ago that the grant money had not been accepted by the Wayne County Commission yet, that we were approving money that has not been officially come to the county. And that just cannot happen. We get tons of grants from the state of Michigan. We cannot be in the habit of saying, well, the state said it was okay to spend it before the commission approved it. I don't have any argument with what this money is for and the services that are being provided. This is just how we do business in Wayne County, and we certainly can't be in the habit of doing this. So there has to be something, some sort of communication with the commission when circumstances like this arise. And we might want to talk to the commission attorney and commission staff if anything like this happens in the future. And Madam Chair, I'd still like to know what happens after October. What happens October 1st then, when this money has been, I think, expended, because it does have, the grant does have a term till September 30 of this year. So what happens October 1st with all of this?
Through the chair, we have already received for fiscal year 22. So that's part of the fiscal year 22 budget money that is through the same grant. So that will start October 1 and run through September 30th.
I appreciate the answers, Ms. Osterberry. Does that mean it may be in the budget, but it has, the grant for next year hasn't been officially accepted by the commission yet, has it?
That is part of the fiscal year 22. That's been part of the whole fiscal year 22 budget proposal from HHVS.
Yeah, but that's not how we approve receiving grants. You're putting it in there. You're putting it in your budget in anticipation, you know, that the state has given us this money or have already notified you that this grant is coming.
Right, it's part of that.
But accepting the budget is not accepting the grant. We have a lot of stuff in the budget that anticipates future revenues, but the actual passing of the budget does not approve all of those things where we are anticipating revenue coming in through the fiscal year. So that does not constitute approval of the fiscal year 22 grant, 21-22 grant. So I think that needs to get before the commission pretty soon so that we don't have this issue again. Commission counsel, am I speaking out of turn here?
And I don't know if fiscal wants to weigh in, but I will say, just generally speaking, that there is no procedure or rule with regards to what comes first, whether the money as far as a budget adjustment is approved first or whether the contract is approved first. So there have been instances where you may get a budget adjustment and then later get the contract, or there have been instances where you'll get the contract first and then later get the budget adjustment. We don't have a rule regarding which occurs first. We do our best if we have them to, you know, submit them simultaneously, but there is no official rule, and it varies depending on the timing of when items are submitted.
Okay, I see somebody from Commission Fiscal has their hand up, but I will say I will wait a little bit here from Commission staff on this issue to recommend either we do something different or we're comfortable with the way this is being done now. But again, I don't want to open a door that more and more of this kind of thing can happen before we actually approve accepting the grant. But Madam Chair, I see we have someone from Fiscal, so I'll wait for those comments. Thank you.
Through this chair, Mary Carr, Commission Fiscal. Felicia is correct. Thank you, Madam Chair. Felicia is correct. Sometimes we don't get the budget adjustment and the contract and or grant agreement at the same time. We try to, but sometimes they lag like a week or two, all depending when the grant's accepted or received. But we try to put them together as much as we can. And in terms of your question on for the October 1st, for when they'll get the money from MDHHS, I believe it is, for the next round for the October 1st, that Carol Osterberry was speaking of. When the grant comes in, we will submit the grant for the commission's approval. We haven't seen it yet, but I'm sure it'll probably be coming within a month.
Well, and I thank you for that, Madam Chair. Just, this is my last comment on the thing. You know, we can't, if administration does know, which they did because they came to us a couple of weeks ago wanting to spend money on this grant. There has to be some communication between administration and the commission when we know grants are coming, and have staffs work out. Well, it's just full knowledge, Madam Chair. It's just full knowledge of the commission that we ought to have talked a couple of weeks ago, that this is money that hasn't been approved by the commission yet, but this is what we're doing. We could have had this conversation then. But I don't like when these things come up after the fact. So I do think we need a way of having communications when this situation arises. Thank you, Madam Chair.
Thank you, Commissioner Colleen. This item was moved and supported. We can have a roll call vote, please. Madam Clerk.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson, Commissioner Anderson, Commissioner Colleen,
Aye.
Chair Baker
Yes.
McCormick.
Yes, Anderson, sorry.
Sorry. Commissioner Baker McCormick,
Yes. It's been moved and supported in all those. We had a roll call vote. Any opposed? I'm sorry, I'm getting distracted here. Any opposed? Any abstentions? All right, motion passed. Next item, please.
Item 3 on the addenda, requesting commission approval of a 2-year contract with 3 one-year options to renew with Black Family Development.
You know what, all of these, I think item 3 through 7 are the care management organization. So we'll take a motion on all 3 and then discussion separately. Is there a motion for approval?
I'll move items 3 through 7 for approval.
Is there support?
Support Anderson.
All right, let's
Madam Chair,
discussion. Yes,
I believe that motion should be contingent upon, if I'm not mistaken. I don't believe the last revision we discussed.
oh,
with the
as
department
amended,
yesterday.
yes. it should-
Just, yes, contingent upon a revision regarding the audit language for the Auditor General.
Okay. Can you restate your motion, Commissioner Dobb? Contingent upon,
Yes, I'd like to move items 3 through 7 contingent upon the changes from the Auditor General.
Support Anderson.
thank you. So any discussion on any of the items 3 through 7? Any questions, any discussion? Commissioner Khalid?
You, Madam Chair. These are 6 items for our CMOs. These are all CMOs, right?
Yes.
Well, I have 2 questions on that. One is, since they're new contracts, did we RFP these things? I would like to hear that from administration. And secondly, okay, maybe I thought we had 5 CMOs and there's 6 here. The I don't, Insight, item 7. Insight is a new name to me. So do we have 5 CMOs or 6 CMOs now?
So Insight, we previously had, they changed their name. I guess a couple of years ago. But this is in my district, so I know that we contracted with them over the at least last 2 years, I would say.
Okay, so it's a company we've done business with before, but they had a name change.
Through the chair, Commissioner, this is Makisha.
Yeah.
Insight, Commissioner Colleen, was Star Vista.
It was.
Yes,
Okay. And did we RFP these 5 CMOs?
yes, we
Since-
did.
Okay, cool. All right, I miscounted. From 3 to 7 is actually only 5. So we have our 5
Correct.
CMOs. Thank you, Madam Chair.
Okay,
Madam Chair,
yes, go right ahead, Commissioner Marecki.
thank you. So these are new contracts. So I would like to know, like, what has changed generally? I know there was a lot of discussion, and we haven't had new contracts in a long time because they were trying to kind of tighten up what we were going to do. But can someone explain to me if there've been significant changes with these groups? And I'm not even sure I'm asking the right question, but are there differences in payment for them, or anything that's significantly different? Because I know it's been about 2 years that we were talking about getting new contracts with these groups. So I'm wondering if somebody could answer those questions, if I'm specific enough here.
Hi, this is Cecily Hoagland. I'm the administrator in the Juvenile Youth Service Division, Department of Health, Human and Veteran Services. So yeah, these contracts are, we included the raise the age legislation goes in effect October 1st, 2021. So these contracts also include the group of that population of youth that were considered adults are now going to be considered juveniles. That's different than the prior contracts. Also, we have the prior contracts, the whole contract was a capitated rate. These contracts, only level 2 residential placements will be capitated, and the in-home placements for youth will be on a daily rate.
Okay, those are the 2 big changes.
And the other change is the funding for the 17-year-olds is the state of Michigan is going to reimburse 100% for services for the new population. The 17-year-olds who were considered adults that are now considered juveniles, that will be 100% funded from the state of Michigan. The other funding is 50-50, child care fund and the general fund.
Okay.
And those are the big differences from the previous contracts.
Okay, thank you. So this payment method then, I'm just wondering why that was changed. I mean, is that more advantageous to the county, or go ahead.
Yes, there, you know, our system of care, we used to have over 1,000 youth that we were they had been adjudicated through the courts. Our juveniles now, we have under 500 kids, which is a good thing. So, but we're trying to incentivize the CMOs to bring kids back into the community so that they're not in residential placement. So we think if we do a capitated rate just for level 2, and then try to bring kids back into the community where they can get services, then there'll be a daily rate. And that's more in line with how the state, they have daily rates for youth that are in the community, and they also have a daily rate for residential placement. But So we kept level 2 when kids are out of the home as a capitated rate, and then level 1 will be in home, and that's a daily rate. So we think
Okay,
it's
so-
more
ahead.
advantageous for the county and for the kids.
Okay, so level 2 means they are out of the home,
Correct.
and level 1 means they're in the home.
Yes.
So you're encouraging them to make them a level 1?
Well,
Is that-
it's the court that determines the level of place. If it's the court that determines the level, but when they're in residential, we can see them. We want the CMOs to see them more, to try to get them to reach their goals, so that when they go back to court, they can be placed on a level 1 and get
Got it.
treatment while they're in their home.
Got it. Okay, so the CMOs then can go see them when they're in the residential as a level 2.
Yes.
And then they'll have a plan when they go back to court that will have a plan set that they'll hopefully become a level 1.
Yes.
Okay, just generally, does that mean a reduction in the monies coming into the CMOs, or?
50 million is 50 million annually. And then 7 million is for the new population, 17-year-olds.
Yeah.
And the prior contracts were 57 million for all 5 CMOs without the 17-year-olds. So the contract is still 57 million, but includes the new population, and the state's going to pay for those youth 100%.
Okay. How many, and I'm sorry I'm asking these questions, I'm just trying to picture. So as far as any of this have to do with Medicare payments of juveniles, or is that?
Yeah, for youth who are, if they need for like the mental health services, and if there's no insurance, then Medicaid.
Medicaid, right, Medicaid.
Medicaid will pay for those services.
Okay, so this contract's not gonna, that's just something that's always been there, and it's not gonna be any different.
Right,
with
that's
the
correct.
with the Medicaid payments.
Yes. There'll be no
Okay.
change in the Medicaid.
Okay, so what do the CMOs think of? I mean, I know they've all come back and want to have a contract, but is there any issues or concerns on their part about this level 1 and level 2 billing?
We have not heard any concerns from the CMOs.
Okay. Okay, thank you for that explanation. And it's a good refresher because you tend to forget this stuff as it goes on year to year. So I appreciate it. Thank you. Thank you, Madam Chair.
Okay, and these are 2-year contracts, so we'll be evaluating the contracts, after the first year and then after the second year. And I think there's 3 1-year renewals.
Okay. Well, thank you very much for the information. Thank you,
You're
Madam Chair.
welcome.
Thank you, Commissioner Marecki. Just to clarify, you said the funding amount is still the same, although we're getting or adding 17-year-olds?
Well, it's 50 million for all the other kids beside the 17-year-olds, and then 7 million for the 17-year-olds, for a total of 57 million annually.
Okay, you said it was 57 million last year, right?
But without the 17-year-olds.
Right, and so that's what I'm suggesting is that we're not really getting funding for the 17-year-olds if it's the same.
Well, we're getting funding from the state. So we did reduce, because the number of kids have been reduced from like over 1,000 to like less than 500. So the CMOs were getting 57 million. So for the next 2 years, they'll be getting 50 million a year and then 7 million for the 17-year-olds.
Okay, because the numbers reduced in the younger group or younger kids. And then how many 17-year-olds do we have?
But we're not sure. We anticipate, can't remember what the number was exactly, but we anticipated, and we don't think they're all going to come in October 1st. We think gradually over the year, they'll start coming in based on, the police pick them up. I can get that number back to you. I can't remember exactly if it was 100 or 200.
Okay. Yeah, if you can, it would be interesting to know how many we think will get of the 17-year-olds. But the total numbers you said have decreased.
The number of youth in the system has decreased.
Okay. And so what is it currently, and what was it 2 years ago, or just the estimate?
Probably about 2 years ago, maybe 1,200 kids in the system.
Okay. And currently?
There's like less than 500, maybe 480.
Okay. Okay, and this is mainly due to COVID or what?
Well, I think probably a combination of things. We have some really good prevention programs, the YAP and the First Contact, which tries to reach kids before they get into the juvenile system. And then we also have a diversion program where if, for certain offenses, they'll hold the charge and abatement. And as long as a youth successfully completes their program, then that charge will go away.
Okay. Yeah, because that's a significant drop of about 600-700 youth, which is great. But I just was wondering if we're not really getting to them because of COVID.
And that could be some of it too, because kids who have, like if they have a charge, they may not show up in court, and then to try to reach them, to have them, if they have a petition and they don't show up, then whenever the police do get them, then they'll have to come back to court. So COVID has reduced some of the numbers. Well, the numbers of petitions that where kids get charged and they have to come to court to see if, preliminary hearing. So there aren't a lot of kids probably entering the system, but I can get you that data because we keep track of the number of kids in the system.
Great. Thank you, Commissioner Killeen.
Yeah, thank you, Madam Chair. And Ms. Hoagland, just for clarity, the state law changed. The legislature and the governor changed the state law so that 17-year-olds would be considered juveniles. Is what you're saying here, first of all, could you just review quickly what that change in the state law was? And do I understand you correctly that the state has said, we will fund you for the 17-year-olds that are now part of your system before the law was changed? The state of Michigan is covering the cost of those 17-year-olds?
Yes. When the law changed, I think it changed. Well, this legislation, there's been a lot of people lobbying for to raise the age. I guess Michigan was one of a few states that hadn't raised the age. Correct. So youth who haven't reached if they're 17, they're not 18 yet, the state is going to cover the cost of services for that group of kids. That's how they're going to fund. So you were considered a juvenile if you, so they raised the age really to like before your 18th birthday. So if you get charged before your 18th birthday, you are considered a juvenile. So 17-year-olds were considered, 17-year-olds were considered adults.
Yeah.
So Michigan raised the age to 18. So 17-year-olds will be considered juveniles, and to help the counties pay for the services, the state is going to reimburse 100%, and I believe it's for 4 years.
Well, I appreciate that, and I hope the state maintains their 4-year commitment. These things have a way of getting smaller and smaller each year as budgets go on up in Lansing. So we'll be very curious as the reports come in the subsequent year or two, how many kids, how much money, and is the state still maintaining its professed 100% support for the 17-year-olds over the 4 years. Thank you, Ms. Hoagland. That was very helpful.
You're welcome.
All right. Well, it has been moved and supported. Let's have a roll call vote.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Anyone opposed? Any abstentions? All right, motion passed. Next item, please.
Item 8, requesting commission approval of a 3-year use and occupancy agreement with an extension of up to 2 years with Western Wayne Family Health Centers.
All right, and then we'll actually take 8 and 9 together. Both of them are occupancy agreements. Is there a motion?
I'll move to approve items 8 and 9, Madam Chair.
Support. Marecki.
All right, it's been moved and supported. Any discussion on these items? Commissioner Dobb.
Thank you, Madam Chair. My question is, so the WIC services, which municipalities will those be provided to?
Oh.
Hi,
Is
Carol
that every
Osterberry.
municipality in the county?
Hi, yeah, Carol Osterberry, Health, Human and Veteran Services Health Officer. That is correct. WIC services are provided for residents throughout all Wayne County. These 2 clinics, one in Lincoln Park, one in Inkster, certainly residents who live close to those office locations, this makes it very convenient for them. But we do have, a resident does not have to live in Lincoln Park to receive services from the Lincoln Park office.
Okay, so anyone in the county can go to these 2 locations.
That is a correct statement, yes.
Okay, great. Thank you.
You're welcome.
Thank you, Carol. Thank you, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Colleen, did you have a
Question was asked and answered. Thank you, Madam Chair.
Okay, great. All right, there's no more questions. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Anyone opposed? Any abstentions? Motion passed. Next item.
Item 10 on the second addenda, requesting commission approval of a 3-year agreement with 1 2-year option to renew with Monroe County.
Is there a motion?
I'll move to approve, Madam Chair. Colleen.
Anyone support? Is there support?
Is somebody going to discuss this?
Yes. You would
Okay.
like to discuss it before supporting?
Yeah.
All right, let's discuss this item. Do we have someone from the administration to discuss this item? Anyone from the administration? Okay. No one to talk to this item today? Do we need to table it?
Yeah, Madam Chair, Andrew Kandrivas from the CEO's office.
Okay,
Don't know why somebody from the MEO doesn't care enough about this contract. I don't know.
I guess I thought it was interesting that we,
Put it on
We
the
took-
agenda. Yeah.
yes, and also that we took on this contract when we, anyway.
I agree with you, Madam Chair. I
Yeah.
absolutely agree with you.
So,
Hi,
Madam
Mr.
Chair.
Kandrivas and Chair Baker McCormick. This is Nellie Lee, Department of Health, Human and Veteran Services. I was under the understanding that someone from the medical examiner's office would be present. However, I am happy to provide any information and answer any questions I can at this point for you.
great. So can you tell us about this contract and when, I know we provided services to Monroe previously. Can you explain how we, the history of this contract?
Hello?
Yes.
Hi, okay, Nellie Lee again. Is my understanding that the University of Michigan, when we outsourced the medical examiner services to the University of Michigan, they also agreed to take on Monroe County's autopsy services as well. So Monroe County contacts the Wayne County medical examiners whenever there is a need for an autopsy completed, and our offices will conduct that autopsy for them. And I understand that this agreement has been in place for at least the past 5 years. And I do believe that it's been longer than that. I wasn't part of the county at that point, so I don't know exactly how many years we have been doing this for Monroe County, but it has been at least 5.
Okay, and so although we don't provide the services, we outsource it through U of M.
Yes.
And although we outsource our services, we took on Monroe County. And
That is correct.
And I guess we have the capacity to service both. And what does that look like, the capacity of what we do versus what we take on?
My apologies, I don't have the exact numbers, but I do believe that the capacity that for Wayne County is higher than Monroe County. And for the last few years, the revenue has been about $100,000 per year. So I would estimate around 100 autopsies per year, because each autopsy is at a unit rate of $1,000.
Okay. All right, Commissioner Killeen.
Oh, thank you, Madam Chair. Yeah, and Ms. Lee is correct. I think it's 6 years ago, we contracted with the University of Michigan for the services of the ME's office. The medical examiner continues to be a county employee, but all the other services we contract with the University of Michigan. And so the University of Michigan, so we pay University of Michigan for these services, including this. This is a revenue contract that we have done since the very beginning, since we contracted with the University of Michigan for the medical examiner's services. So we've done this right from the very beginning when we transferred over. My question here is, I do believe that the contract with the University of Michigan in managing the MEO's office is coming up for renewal soon. When does the contract with the U of M run out?
Commissioner Colleen, the contract with U of M expires on September 30th, 2022. At this point, I do believe that the intention is to renew that contract. But I can't say for sure. I have not been, it's still early, but I believe that that is the intention.
Well, that's what I thought, that the contract has one more year on it with U of M. And so, Madam Chair, we will be seeing either renewal of the U of M contract or a different direction from administration in the coming year, because there's only one more year that we have contracts for these services. So thank you, Madam Chair.
And if I may, Madam Chair, Dr. Carl Schmidt serves as the medical examiner for Wayne County and Monroe County.
Great. Thank you, Commissioner Colleen. Are there any other questions from commissioners?
I'll support this. I don't think we have a support.
We did not. Thank you.
Sure.
All right, let's have a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen, Chair Baker McCormick.
Yes. Anyone opposed? Any abstentions? Motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
All right. Can you unmute everyone, and we will take public comments.
We do have an email public comment.
Okay. Let's see if there's anyone on the line, on the phone or on Zoom that has a public comment. Anyone? I don't see any hands. All right. Can you read the email for us, Madam Clerk?
This is from Shirley Martin. Dear Commissioners, the Detroit Symphony Orchestra is requiring proof of vaccination or recent COVID-19 tests to attend performances this year. Vaccine passports, DO, exist in Wayne County. Yes, patrons are given the choice to attend or not attend under this mandate. However, this mandate is based on the lies and misinformation about the COVID-19 vaccine's ability to end the pandemic. As recently as August 2021, studies published by the CDC, UK government, and Oxford University find that COVID-19 vaccines do not work. Requiring a vaccine passport to attend the DSO performances is discrimination. It is dividing patrons into two groups, the haves and the have-nots. The have-nots must spend more money to obtain COVID-19 tests as well as their theater ticket. Also, since it is a known fact that the vaccinated and unvaccinated can spread the virus equally, why don't the vaccinated have to prove their health with a COVID-19 test too? That is discrimination, pure and simple. There is no scientific proof that vaccine passports are necessary. The many unvaccinated people of Detroit and Wayne County are losing their medical freedom of choice because of them. End vaccination passports through defunding businesses, organizations, etc., who require them. Shirley from Livonia.
Thank you. All right, if there's no other public comments, we can move to the next item.
Adjournment.
Is there a motion?
So moved.
Support.
Been moved and supported. And meeting is adjourned. Thank you all. Have a good day.